If you've been using antipsychotic polypharmacy to treat schizophrenia, I've got some new findings here that might change how you practice. These two new studies from the SWAP trial, that's Switch Antipsychotic Polypharmacy trial, were published in Schizophrenia Research, and they suggest that switching to monotherapy could offer these patients significant benefits. Our first study took place with long term inpatients with schizophrenia, 136 in all. These patients were randomized to two groups. One group continued with the antipsychotic polypharmacy, and the other group gradually switched to a single agent. Surprisingly, the relapse rate was lower when the antipsychotics were reduced. Over 9 months, those who transitioned to monotherapy had fewer psychotic symptoms and a 29% lower risk of relapse. Astonishing when you consider that we're taking an antipsychotic away in a randomized fashion. Outcomes were best for those who stayed on clozapine as the single agent. The second paper looked at adverse effects as they took antipsychotics away in the SWAP trial. Patients who switched to monotherapy saw significant reductions in movement related side effects like akathisia, Parkinsonism, and dyskinesias. They also had improvements in BMI and weight. Additionally, symptoms like depression and gastrointestinal issues improved significantly who those who had their dosage reduced to monotherapy. However, there was no noticeable change in sexual and neurologic side effects between the two groups. These findings suggest that moving from antipsychotic polypharmacy to monotherapy, particularly when that monotherapy is clozapine, can reduce relapse risk and alleviate multiple side effects without compromising symptom control, at least in this population that they studied of long term hospitalized patients. Focusing on single effective medications could enhance safety and improve the quality of life for your patients with chronic schizophrenia. It reminds me of another study where giving too many or too high doses of antipsychotics increased mortality rates, as did very low doses, but sticking right in the middle led to the longest lifespans for people with schizophrenia.